Everything possible should be done to reduce the severe social and psychological effects of deafness. Often, however, the only help offered is a hearing aid, which is only likely to be of real benefit if rehabilitation counselling is also given. The early hearing aids were cumbersome and subject to ridicule, but simple to use and maintain and effective for some people. Ear trumpets and conversation tubes are still applicable to some elderly people. Modern technology has given us a range of more sophisticated hearing aids. Unfortunately, many of them are not used. This may be because the person starts with a negative attitude towards their hearing aid or has unrealistic expectations of the benefits it can give. Frequently, insufficient counselling and advice have been given on how to use the hearing aid. Also, it may not be the most appropriate model for the individual. So, in Part 2, we describe the various types of hearing aid available and the steps involved in obtaining one. This is followed by some advice on its use, care, and routine maintenance, and then on how to get the most from it, bearing in mind its limitations. Finally, we describe some other equipment which is available for people who are deaf. Now for Part A. If someone thinks they have a hearing loss, they should first go to their GP, who can check whether there's some problem, such as wax, which is easily remedied. If necessary, the GP can refer the person for a hearing test, which may lead to provision of a hearing aid. Alternatively, one can be bought from a private dispenser. The technician or dispenser will select the appropriate hearing aid depending on the results of the hearing test and other information about the person. The commonest test is called an audiogram. This requires the person to listen to different tones which get gradually softer. The technician plots a chart to show the pattern of hearing loss in each ear. Here we have an audiogram for a person with normal hearing and another one showing a hearing loss. This is the audiogram of an elderly person who's lost the ability to hear high tones. Another test, which is sometimes used, measures the person's ability to understand speech and is called a speech audiogram. If it's agreed to supply a hearing aid, the technician makes an impression of the person's ear for an ear mold. The ear mold has to be sent away to be made, so the hearing aid itself is usually fitted at another visit when the ear mold is ready. There are many models of hearing aid available to suit different types and degrees of deafness and individual preferences. Modern hearing aids basically consist of a microphone, a power source, an amplifier, and a receiver with an ear mold or vibrator. The main types of hearing aid available are body-worn, behind the ear, in the ear, and intracanal aids. A body-worn hearing aid has a compact case, which is usually worn on the chest, with a connecting cord to a receiver and ear mold, or a headband and small vibrator for bone conduction. The headband can be covered to match the hair color, as shown here. Some body-worn aids, such as these, are very powerful. A behind-the-ear hearing aid is a small plastic unit which sits neatly behind the ear and is connected by tubing to an ear mold. Models are available to suit most degrees of hearing loss. They're usually inconspicuous and are available in different skin colors. In-the-ear hearing aids are even smaller and have to be molded to fit inside the ear. They may be low or medium power for people with a slight or moderate hearing loss. Intracanal aids are the smallest. They have to be molded to fit into the ear canal and are only suitable for people who have a mild hearing loss. Spectacle hearing aids consist of spectacles with the hearing aid components in the arm. They can have a normal ear mold or a vibrator which rests on the bone behind the ear. Communicators are used to talk to a hearing-impaired person who does not have or is unable to use a conventional hearing aid. They can be very helpful in easing communication and preventing embarrassment and frustration. Some communicators need no batteries. For example, ear trumpets, and conversation tubes. These can be helpful to someone who has a slight or moderate loss. People often like these because the sound is natural. There are a variety of other communicators which are battery operated. These can be more powerful, so can also help people with a more severe loss. The ear mold is an essential part of a hearing aid. The ear mold fits into the ear canal and has to be made individually for each ear in which a hearing aid is worn. The ear mold for a body-worn aid is flat underneath and incorporates a retaining ring which clips onto the receiver of the hearing aid. It's called a solid ear mold. There are a number of different types of ear mold for behind-the-ear hearing aids. For example, there are shell ear molds for the left and right ears. A skeleton ear mold may be less conspicuous and can be easier for someone with arthritic fingers. Ear molds can also be made from different materials. Softer, non-allergic plastics can be used to avoid the irritation that many hearing aid users experience from a hard silicone ear mold. They may also be colored, opaque, or clear. Hearing aids can never cure deafness. However, most people who are deaf can benefit from a hearing aid if the appropriate counseling and support are given. We'll look at the help and advice hearing aid users need in the next two parts of the program, starting with how to use and maintain the aid. First of all, we'll describe the parts and controls of some common types of hearing aid, starting with the behind-the-ear type. In a behind-the-ear hearing aid, the microphone, amplifier and battery are all in the rigid case, which also houses the volume control and switch. All behind-the-ear aids are basically similar, but the positions of the controls and the direction in which they move differ from one model to another. Once you can recognize the controls, it should be easy to find them on different models of hearing aid. The microphone may be at the top or bottom of the hearing aid. If the microphone is at the bottom of the aid, it tends to pick up sounds from behind rather than speech from in front of the wearer. A few commercial hearing aids have more than one microphone. The amplified sound is fed into the ear through a rigid plastic tube known as the elbow. Then a soft, flexible piece of tubing joins the elbow to the ear mold. Inserting the ear mold in the ear can prove difficult at first, but it becomes easier with practice. First, make sure that the hearing aid and ear mold are the right way round and that the ear mold is not blocked with wax or debris. The top point of the ear mold must go behind the fold of skin. Push the ear mold firmly into the ear and lift the body of the hearing aid behind the ear. Check that it's comfortable. Many people make the mistake of leaving the top point of the ear mold in front of the fold of skin. This will cause problems. Now let's take a closer look at the controls. On most hearing aids, the switch has three positions. The letter O shows the off position for when the aid is not in use. M stands for microphone. In this position, the aid is switched on and can pick up sounds from the environment. Many hearing aids have a third position marked T, which stands for telecoil. In this position, the aid does not pick up sound from the environment. It's used with some equipment like loop systems and special telephones, which will be described later. In some hearing aids, the switch is incorporated into the volume control, or the aid is switched off by partially opening the battery compartment. The volume control is a small wheel, which may have numbers on it. The user has to adjust the volume control depending on his or her level of hearing and on how loud the voices and other sounds are. It may need adjustment as the volume of sound changes. The power source for a behind-the-ear aid is a small battery which normally lasts from 3 days to a month, depending on the power of the aid and how much it's used. The technician or dispenser will tell the hearing aid user which batteries to use. The types suitable for most behind-the-ear hearing aids are mercury batteries. These are usually supplied in packs of 6. Zinc-air batteries, which come in packs of 3, last longer, but they're not suitable for high-power hearing aids. They have a sticky tab which must be removed before the battery is used. Batteries run out suddenly, so the user should always carry spares. Before inserting a fresh battery, wipe it with a cloth to remove any dirt or condensation. Batteries should never be stored loose, as any remaining charge could discharge with other loose batteries, causing them to heat up, possibly even causing a fire. Used batteries should be stored in their original container. They may be returnable for replacement. The battery drawer may be at the back or base of the hearing aid. It may open in either direction. When you open it, you'll find a small cross on one side of the drawer. Usually, the bottom of the drawer is slightly convex. The battery must be inserted the correct way round. To help you, look for a small cross on one side of the battery which must be matched with that on the drawer. However, with most hearing aids, it may be easier just to match up the slightly convex surfaces of the battery and battery drawer. Never force the drawer closed. If it doesn't close easily, the battery is probably the wrong way round. Unfortunately, many people have problems with hearing aids. Firstly, they may find that the aid whistles like this when it's in the ear. This could be due to one of the following causes. The ear mold may not be properly inserted in the ear. If the hearing aid whistles even though the ear mold is correctly positioned, the ear may be blocked by wax or an infection. A doctor should examine the ear and treat it if necessary. Never try to remove the wax yourself by poking something into the ear. Alternatively, the whistling may be because the ear mold has become loose and a new one is needed. The hearing aid technician or dispenser can advise on this and other problems. Sometimes, however, the hearing aid itself may appear not to be working properly. If so, take it out of the ear, switch it on, and turn the volume control up to maximum. Cup the aid in your hands. It should whistle. If it doesn't, then something's wrong. This could be due to one of several things. A common problem is a dead battery. Try a new one. Alternatively, the ear mold or tubing may have become blocked with wax or condensation. It's important that the ear mold is always kept clean. To clean the ear mold, first remove it from the aid by gripping the elbow and pulling the soft tubing off. Do not pull the soft tubing out of the ear mold or remove the elbow from the hearing aid body. Wash the ear mold in warm soapy water, then rinse it. Tap any water drops out of the tube and dry the ear mold. Alternatively, you can blow the water drops out of the tubing. The ear mold should be reattached so that its curve matches that of the hearing aid body. The functioning of the aid will also become impaired if the soft tubing becomes hard or cracked, in which case it must be replaced. The hearing aid technician or dispenser can demonstrate how to do this and provide replacement tubing. Usually the soft tubing needs to be replaced about every 3 to 6 months, although it may last for a year or more if the aid is only worn occasionally. If the tube appears to be cemented in, do not attempt to re-tube it yourself. Return it to the hearing aid center. We'll now consider how to use a body-worn hearing aid. We looked at some of its features earlier. The aid consists of a rigid body which contains the batteries, microphone and controls. It has a separate receiver which is connected to the body of the aid by a flexible cord. As with behind-the-ear aids, the position of the controls varies from one model to another. Here is another example. It's one of the most common low-power aids which was issued on the NHS. Body-worn aids may be appropriate for people who have poor sight and arthritic fingers, as the controls are larger and easier to use. Most people find that the best way to wear a body-worn aid is near the center of the chest, clipped onto outer clothing with the microphone facing forward. The cord can be concealed under hair or clothing. Some people prefer to use a special hearing aid purse with a neck strap to hold the hearing aid. The aid can be worn underneath light clothing, but heavy clothing will muffle the sound and may make a noise from rubbing and static. The power source for a body-worn aid is normally a penlight battery. Before inserting it into the hearing aid, wipe the battery with a clean cloth. It must be fitted the correct way round, with the cross on the battery matching that on the battery drawer. The aid gradually gets fainter as the battery runs down until eventually it does not work at all. Dead batteries should be removed immediately. They should also be removed if the aid is left unused for more than a week. Old batteries can leak, causing serious damage to the hearing aid. Never try to heat or recharge the batteries unless they are the special rechargeable type. Throw old batteries away. Make sure the replacement battery is a fresh one and is not corroded. The battery compartment may be in the back of the aid and can be opened by sliding the back of the aid. Alternatively, it might be at the base of the aid. Some have two batteries. Be sure to replace both at the same time. Each hearing aid is issued with a handbook which explains how to change the batteries. Problems can also occur with body-worn aids. To check if the aid is working, turn it on to full volume and put the receiver near to the microphone on the body of the aid. If it's working, it'll whistle. If there's no whistle, first check the batteries. Another common fault of body-worn aids is a cracked or broken cord. It often breaks internally near one end where it's not seen. The sound may become intermittent or the aid may go completely dead. To change the cord, unplug the ends from the body of the aid and the receiver and plug a new one in. Usually the plugs have one large pin and one small one, so they'll only fit one way round. Finally, as with behind-the-ear hearing aids, the ear mold can become blocked like this. It should be removed regularly for cleaning. It can be detached by holding the receiver with one hand and the ear mold with the other and pulling them apart. Wash the ear mold with warm soapy water, then rinse and dry it thoroughly before clipping it back onto the receiver. Hearing aids are expensive and need proper care. The following guidelines apply to all types of hearing aid. Always turn the aid off when it's not in use and keep it in its case. If it's left switched on or in the T position, the batteries will run down. Never put the hearing aid in a hot place, such as the oven, on a radiator, or in direct sunlight, as this will damage the aid. Make sure it's out of reach of young children and pets. Dogs are attracted if the aid is left whistling, and hearing aids have often been chewed beyond repair. Avoid dropping an aid onto a hard surface, as it can be broken. Never try do-it-yourself repairs on the aid other than the routine maintenance of replacing batteries and cords and washing the ear mold. If the aid is faulty, return it to the hearing aid technician or dispenser for repairs. Never use alcohol, cleaning fluids or oil on a hearing aid. The aid should also be removed before using hairspray, as this can clog up the controls and melt the plastic. Always keep the hearing aid dry. Protect it from rain and do not try to wash it. Of course, it must be taken off before showering, swimming or hair washing. And finally, the hearing aid, including the receiver of a body-worn aid, should be wiped only with a clean, soft cloth. A hearing aid is just a general-purpose amplifier that increases the volume of all sounds. There is a limit to the amount of help it can give, so it's important to know how to get the most help from it. This is what we're going to look at in Part 2C.